Anything, commissioners, that you'd like to add to that?
I have none.
Any questions or concerns from here in the room? Yes, please, Roy. Thank you.
So it's recommended and not required?
What's recommended?
Masks.
Masks required.
Required.
Yep.
Okay. I want to just talk to you a minute for about something that I don't like using the word hate, and I really try not to ever use it, but I hate wearing a mask, and it's because I'm claustrophobic. And anybody that's never experienced what it is doesn't know what it's like. And it's just like experiencing somebody saying, "Oh, I can't see that person being depressed." If they've never been depressed, they don't know what that really is. Anybody physician that's ever tried to give me an MRI would probably write me a script that I didn't have to wear a mask because I cannot handle it. There's not enough Valium in Walgreens drugstore to put me in an MRI. I'll never get in one again. So when people see somebody that's not wearing a mask, there's so many people that want to judge you today and say, well, that person's a rebel or he doesn't want to comply with everything. I've complied with it because I like my job, and I have respect for people that want to have me wear one when I'm in their building or whatever. But I got to tell you, it's really hard. And so I just want everybody to understand that if somebody's not wearing a mask, and I hate to see what it's going to do to 5-year-old kid going to kindergarten if they, we have no idea what that's going to be like. But I just want you guys to know that that's how I feel about wearing a mask, and I'll wear it if it's required. But it really does bother me quite a bit. I have a hard time with it. So that's my.
Thank you, Roy. Dr. Elias, could you, what's the process maybe for getting a medical exemption for that? Would you kind of walk us through that?
That would have to come from their private physician. Generally, the exemptions are for people who are unable to verbalize or be able to take a mask off in the event of a medical emergency, those types of situations. And I guess one other point of clarification, the masks wouldn't be required when somebody was sitting in their own office with their door closed and they were the only person in there. If somebody were to come to the door, come in the office, then they would be required to put their mask back on.
And if they were walking in the public spaces, then the mask would come on. Is that correct, Dr. Elias?
Yes, definitely. Yes.
Okay. Any other concerns here in the room? Stacey.
Thank you, Chairman Gosar, commissioners. I do have a concern about the enforcement of this. We had a really hard time the last time we put one of these in place, and the people who walk through the door and are very angry about it. What do we do then? Who do we call? Because I see it already and it hasn't even been put in place yet. And it's scary for our employees. You have, I just don't know who. Are you expecting that the employees are going to enforce this?
Well, should people not respect that, right? They can more than happy call me. My number is in the book and it's in the paper. I, however, have to tell you, because something is hard, does not make it the wrong thing to do. Today, I wore this mask the entire day. I took it off for dinner, and I'll be wearing it tonight. Now, it's easier for me to wear it than somebody else. I understand that. But we are in a pandemic. And also, got some statistics here today in 5 minutes on the internet. On June 1st, in the United States, the 7-day average for cases was 12,541. 6 weeks later, on August 16th, the 7-day rolling average is 141,365, a full 11 times greater. New cases in June 1st, 15,977. New cases 6 weeks later, 252,369. We passed the largest number of people under 50 hospitalized since the pandemic began yesterday.
And I realize that. I'm not arguing
Yeah.
the statistics. I'm not arguing, I'm arguing for my employees who have that angry person on the other side of the counter. Am I calling the sheriff's office? Am I calling one of you to come and defend my employee when you have that guy that's ready to come over the counter because he's very angry because someone is telling him that I have to put a mask on? I totally understand the statistics. I'm not arguing your statistics. I'm not arguing what Dr. Elias said, but I am concerned about our employees. And that's just, I just want that
On the record.
on the record and in your minds, because it will happen. And I think we've all of us that have been in the building before and dealt with it the last time have had to face that. So I just want that on the record.
Well, thank you,
Thank you.
Stacey, and I appreciate your office and everybody else's office who has to deal with that. I think the solution is we have two tools for this that we can think of: vaccination rate and mask wearing. Albany County is less than 45% vaccinated as of today, so more than 1 out of every 2 is unvaccinated. And take those statistics in consideration. And if my number needs to be put on the door, I'm more than happy for people to call me. I can't imagine when they call me that I'll be changing this resolution because I'm unable to, but I'll be more than happy to explain my reasons for voting the way that I will here in a minute. I know that probably doesn't help, Stacey, but so this need to make some business cards with my name and my number, and we'll just hand it out to people that are angry about it. This is quite honestly a health emergency, and for 90% of the American doctors have taken the vaccine. Or 90%. Those are our health experts. I am not a health expert, but they are. And so I think that there should be some concern for that. Yeah, Adam, I see you have your hand up. Sheriff Applehands, please. Thank you. Go ahead.
I just wanted to put it out there for everybody, especially those that work in county buildings. If you do have any type of security issues with your staff, regardless of what the security issue is, they're always available to call my office and we can navigate that issue for you.
Thank you, Sheriff.